Pre-COVID, how much did you know about or pay attention to your local health board? For a lot of people, probably not much, unless that pond you frequented was closed due to a bacteria outbreak or that restaurant you love had a health violation. With the pandemic, that changed. Those local health boards became very polarizing as they handled things like mask guidance, COVID closures, and vaccine rollouts. You know, there was a stretch when we actually looked forward to health district board meetings. A health district at the center of a lot of controversy is about to have the second newest member in months. The final three candidates for the open Central District Health Board physician position had public interviews today before Ada County commissioners, and they're going to make their final selection tomorrow. The board physician was Dr. Ted Epperly. 2 days before his third term ended, he was informed, well, his next term wouldn't be renewed. The final candidates then interviewed today are Drs. Ryan Cole, Stanley Moss, and Dr. Sky Blue. For some insight on how the interviews went today, Joe Paris is watching this all play out this morning, mostly this morning. A lot of attention, Joe, on this board opening to becoming overly politicized.
Yeah, there's been a lot of conversation in recent days about the whole situation being politicized. And yes, it's not supposed to be. To be very clear, none of the candidates we're about to talk about are affiliated with a political party, and they said as much during the interviews this afternoon. But let's take a look at some of the moments from the interview session that, as Brian referenced, was this morning into this afternoon. Each candidate got about 30 minutes. First up was Dr. Sky Blue. He's a physician with Sawtooth Epidemiology and Infectious Diseases. They're an independent group that treats patients in all the hospitals in the Treasure Valley. And Dr. Blue has over 25 years of experience working with Central District Health and other state agencies. A major topic during the interviews for all the candidates was the COVID vaccine. Commissioner Kendra Kenyon with Ada County asked Dr. Blue what he thought about CDH's role in trying to get the community vaccinated. Here's what he said.
Strategy without tactics is the slowest road to victory, but tactics without strategy is the noise before defeat. So vaccinations, I would say, is a tactic. And if anything, I'd have to look at the strategy, which at least based on the vision and the mission of Central District Health is to promote and protect the health of our communities. And the data that came out of the state from May to July show that 95% of the cases occurred in the unvaccinated, 95% of the hospitalizations in the unvaccinated, 95% of the deaths in the unvaccinated. So if we had to look at a tactic to help promote and protect the health of our communities, you have to look at vaccination in that strategy.
Of note for you, Dr. Blue, was nominated for the health board back in January, but Commissioners Rod Beck and Ryan Davidson, they both voted to instead recommend former U.S. Representative Raul Labrador, who was confirmed and is currently on that board. The second candidate interviewed was Dr. Stanley Moss. He's a retired orthopedic surgeon here in the Valley. He's lived here for about 40 years. Dr. Moss touched on his experience outside of orthopedics, saying that he's well-versed and educated outside of just that practice. He believes that he also has great working experience and working relationships with the local health systems, making him a good candidate for the spot. Again, COVID and the vaccine rollout, there were big interview topics. Here's insight from Dr. Moss on what he thinks about getting vaccines out.
96% of all physicians in the United States have now been vaccinated, but only 60% of the population in general. So why is that big discrepancy? The discrepancy in my mind is because the physicians understand the safety and the efficacy and want to end this pandemic. And if the general population had the same information and confidence in the vaccine, those rates of vaccination would be much higher. But I do not agree with any attempt to coerce or force or threaten people that they have to get the vaccine. It's a matter of educating them, and then they'll make their own correct choice. Now, if you give people freedom of choice, there's always those that will make the incorrect choice. But with education, that number becomes quite small. I think as people understand how safe and effective this is, and they want the pandemic to end, they will choose voluntarily to get vaccinated, and that will solve the problem with the pandemic of COVID-19.
As you heard Dr. Moss, he touted the effectiveness and safety of the vaccine, saying that it was an overriding principle for him that people do have individual freedom to choose. His point, though, is to get the facts and context of data out to the people. Finally interviewed today was Dr. Ryan Cole. He operates Cole Diagnostics, which is a testing lab in Garden City. Now, Dr. Cole drew attention for comments he made about COVID and the vaccine, as well as handling the pandemic, including here on the 208. Now, some of his comments have been characterized as comments being anti-vaccine. In response to that, Dr. Cole told us earlier this year that he wanted to clarify that he is in fact not anti-vax, but that he did have some concerns that he stands behind still about the long-term effects of the COVID vaccines because of the use of mRNA technology. Simply, he basically says we don't know the effects of what the vaccine could do to someone 10 years from now because it hasn't been 10 years since the COVID vaccines were produced. Like the other two doctors we just heard from, here is Dr. Cole's answer to the commissioner's questions about vaccines and health strategy with the rollout.
Health freedom is critical. Literally, physical integrity, it is your body, it is your choice. You should be able to be a responsible citizen, but a free citizen to make the health decisions that are best for you. We as a community should help people make those, but I think forcing things engenders distrust. Delta has escaped what we're doing. We need to societally pivot right now. Delta, if we look at the data from around the world, look at Israel, 80 to 90% of people in the ICUs are double vaccinated. So we're giving a vaccine right now for something that was 4 variants ago. It's like saying to your hospital employees, all right, flu season's coming. Let's give you the flu shot. Oh, by the way, we have some leftover vials from 4 years ago in the freezer. You wouldn't do that.
Of note, experts do say that the vaccines out there are safe and very effective against COVID, as well as the Delta variant. Dr. Cole is referencing the fact, though, that in Israel, there is a study going on about the effectiveness of the Pfizer vaccine against the Delta variant. There is evidence to show that it is less effective, but it is effective 100% in diminishing the chances that you'll have a serious COVID infection if you are, in fact, fully vaccinated. Again, Brian, we heard from the candidates here today. Tomorrow, we're expecting the decision from the Ada County Board of Commissioners, and then we will go from here.
All right, well, you talked about the political side of this. Now let's talk a little bit more about that. Thank you very much, Joe. Something that was brought up a few times during this morning's public interview session was how this decision on who would sit on the board of Central District Health was somehow construed to be political, and that this was somehow put upon the Board of County Commissioners. Well, here's a sampling of what was said.
Those that are decrying politicization are the very ones that are bringing politicization to the issue. And I'm going, it's not us, it's you.
And so I think our higher calling and what we try to do, and we've tried to do this since day one, is to try to take the politics out of things as much as possible and not listen to 1 or 2 or 3 or 4 people, or for people that are just sending up massive email groups. I think any person that comes on this board, I really want them to understand that I think that's where we're coming from. And we're not going to be making a political decision here today. I think the media would like us to.
Oh, sure.
The media. Well, how a decision to replace the one required doctor on the Public Health Board has been painted with a political brush is now the media's fault? And maybe Commissioner Kenyon is referring to social media, perhaps. But let us remind you, the last board seat filled by this trio of county commissioners was to replace an elected county commissioner who voted in favor of many community restrictions and happened to be a Democrat and lost an election. They replaced Diana Lacayando with a former Congressman, Raul Labrador, who went to North Idaho in May of 2020 to celebrate the opening of a brewery before Governor Little's reopening phase said it should. And even if you concede, well, that was a political position, that one was. The lone physician position wouldn't be one, right? We'll let Ada County Commissioners speak for themselves on this. Here's what Commissioner Rod Beck said the day they announced Dr. Ted Epperly's appointment would not be renewed. On June 28th, I think the Central District Health Board would now be best served by someone with a different perspective who represents the community. Commissioner Beck's colleague, Commissioner Ryan Davidson, went even further. We can clearly see that government lockdowns and forced mask mandates had little effect on the overall course of the pandemic, he said. Certainly nowhere near the level that would justify the shutting down of an economy and the suspension of individual liberties. Therefore, not only did Central District Health fail the greatest moral test of a generation, he said, they also failed the scientific test, as none of the doomsday predictions ever came true. Not sure why that was. Since Dr. Epperly supported such restrictions as a member of the Central District Health Board, I cannot in good conscience support his reappointment. someone with a different perspective. Much like board member Lacchiando, Dr. Epperly often was in favor of more restrictive policies to help stop the spread of the virus. Dr. Epperly served 15 years as a doctor with the Central District Health Board. That's 3 5-year appointments. And much like the doctor who served before him, Dr. Martin Gabica is now retired, but was a family physician for 30 years in Ada County. And he also served 3 terms on the CDH board. The 15 years right before Dr. Epperly took over. So we thought we'd get some perspective from someone who's been in that position. And Dr. Gabica said there's always been controversy with public health boards.
We always had controversy. There's always going to be controversy when you're dealing with public health. Most of our controversies at that time were around septic systems. The 2 lakes in Valley County had issues with quality. We've always had issues with immunizations. We had measles outbreaks during that time because people weren't getting their MMRs and their kids. That was the autism scare. And that, caused a whole bunch of research to occur, just refuted all of that. We also had outbreaks of hepatitis A to deal with and outbreaks of STDs to deal with. Those were the big issues at that time.
You've always had controversy as a board member of Central District Health. But 15, 20 years ago, was it political?
There's always been a little bit of political issues going on. Like we had some appointments for Ada County that were controversial at that time, and people who didn't understand public health very well and would come in and make comments and suggestions and want stuff done that really didn't jibe with the science. That has always gone on.
Has it really?
Yeah, a little bit. We never saw the issue of a doctor on the committee being politicized. It was more the county commissioners that went on the committee that were politicized in those days.
What's the difference between the argument over MMR or what you guys had to deal with as board members back then versus the vaccine discussion now?
Not a lot of difference. It's all about fears that it's all about people not understanding the science and fearing things that are not worthy of being afraid of. And there's always research issues. I don't trust this thing because they haven't researched it well enough. It's hard to understand that with the current immunization. I mean, 3 billion people have been immunized? We got more data on this immunization than any immunization in history at this period of time. So it's a little interesting that way. I think we need to help people understand science better and understand the difference between science and personal opinion in order to help get us around some of these issues of worrying about the risks of the immunization.
Politics has always kind of been there on these district health boards because of the county commissioner's involvement. The county commissioners of Ada County said, this is not today's decision or what they heard from today, and we'll make that decision. They're not making this political. Do you believe that?
It's a bunch of baloney. Why would they say something like that when they clearly were trying to get rid of Dr. Epperly because he was pushing for a mask mandate? I mean, I don't believe it at all. The problem for me becomes in how do you meld politics with what's best for the community? Their job, those county commissioners, is to make decisions that are best for the health and safety of the citizens of our county. And sure would like to see them do it that way rather than because they're looking for a better job in politics.
All right, I want to apologize there for the technical issues at the end of that interview. Dr. Gabica up in McCall, where apparently the internet needs some help. If only there was a plan for infrastructure with that. Well, Dr. Gabica, by the way, says he supports Dr. Blue as the perfect candidate, like hundreds of others who sent emails to the Ada County Commissioners as they were gearing up for this hearing today. From July 8th through August 5th, they received nearly 3,000 emails, according to their website. And while a lot of those were in support of Dr. Blue, there were a lot more, though, in favor of Dr. Cole. Dr. Epperly's term ended at the end of June, as we mentioned, and the day after the commissioners announced the candidates, that would be July 8th, they were sent about 30 emails. And through most of July, the emails just kind of trickled in, one or two here and there. Then on August 2nd, the Ada County Republicans posted on social media a call to action reminding members of the decision the board was about to make and to send them your opinion on whom you would like to see fill that seat. A day later, the same kind of call to action that is, from the Idaho Liberty Dogs, which is the same group that shows up to oppose any Black Lives Matter or defund the police rally. But their post included a preference, Dr. Ryan Cole, and they included a prompt that included a typo, something many just copied and pasted into their email to the Ada County Commissioners. I urge you to appoint Dr. Ryan Cole to the vacancy of Health Board, it said. To the vacancy of Health Board. And in skimming the thousands of emails, we found those exact words dozens of times. To the vacancy of Health Board. From August 2nd through August 5th, yeah, it's all there. You can see it. Oh, there was some copying and pasting done by Dr. Blue supporters, but usually with more words and without the typo. As a well-respected physician, it said, who specialized in infectious diseases, he is exceptionally qualified. So those posts prompted people to send in the most emails. 2,500 of the nearly 3,000 emails came during that first 5 days of August. We couldn't account for all the emails sent from the same person or the same account, but there were several of those as well. Nor could we tally all the emails from out of the area. And there were lots of them, from as far away as Coeur d'Alene in Kootenai County to several from Payette, Kimberly, Nampa, Caldwell, Twin Falls, and Idaho Falls, none of which are actually under the jurisdiction of Central District Health. They cover, by the way, Ada, Valley, Boise, and Elmore counties. We're still going through an additional 400 emails Ada County received August 6th, which was the last day they received public comment. And again, as you heard Joe mention, they are expected to make their announcement tomorrow.